Hi, my name is Anika. I'm a student nurse at the University of Northeastern Philippines. And for our related learning experience today, I'm going to be demonstrating eye assessment. Now, my client for today is a 17-year-old female. Let's go ahead and proceed with the procedure. Now, prior to approaching the client, we have to make sure that we have provided client's privacy by closing the door or drawing down the curtains. This is for us to promote comfort to the client so that they will feel comfortable during and throughout the assessment. Also, make sure that you will be doing hand sanitizing or proper hand hygiene so that we will not be able, or we will be preventing any spread of microorganisms during the assessment, specifically because eye assessment involves a lot of touching the client. So once that we're done with that, we can now go ahead and approach the client and introduce ourselves, confirm her identity, as well as explain to her the procedure. Hi ma'am, my name is Anika. I'm a student nurse for today, and today we will be doing your assessment. By the way, what's your first and last name?
Julian Pate.
Oh, hi Jillian. So eye assessment is being done for us to be able to, what do you call this? Detect or determine whether if there are any vision or eye problem existing or could be existing, or if you are at risk for any eye or vision problems. And then this is for us to be able to initiate early treatment as soon as possible. Okay, you understand that? All right. Okay, so throughout this assessment, I will be performing a lot of procedures that could touch your eyes. So I hope that you don't mind. Is that okay with you? All right. Thank you so much, Julian. Now, prior to the physical assessment, I have a couple of questions to ask. This will be revolving around your current knowledge about your vision, your health. So, my first question is, have you experienced any visual difficulties? No, alright. Okay. And do you see any spots or floaters in front of your eyes? Like, can you see, like, if you look into an object, is there any spots or like dark spots or an area which is blur? No. Okay. I'll take note of that. And do you experience any blind spots? No. Okay. And do you see any halos or rings around light? Say, for example, look at this light. Is there any round rings or halo looking object around the light? None? Okay. Alright, I'll take note of that. And do you have any trouble seeing at night? None. Okay. And do you experience any double vision? Can you look at my fingers? Can you see, have you ever experienced seeing, like, say for example, you're looking at my fingers and you can see two fingers? No. Okay. Alright. I'll take note of that. Now, do you have any eye pain or itching in your eyes? None. Okay. Do you have any redness or swelling in your eyes? Okay. Do you experience excessive watering or tearing of the eye? Like, you're not crying, but there are tears or there are water flowing down your eyes? No. Okay. Have you had any eye discharge? Like an unusual discharge in your eyes? Say for example, white watery discharge, yellowish discharge? No. Okay. Have you ever had any problems with your eye vision? None. Okay. Have you ever had any eye surgery? None. And when was your last eye exam? Have you ever got eye exam during your elementary days? Yes. Okay. When was this? What year? Year 2000 what? What grade are you in when you were having an eye exam? Grade 6. So this is what? What grade are you at right now? Grade 10. So this is like 4 years ago, right? Okay. Do you have any prescription lenses? Do you wear glasses with grades? No? Alright. Have you ever been tested for glaucoma? No? Okay. Is there any history in your family of having vision loss, blindness? Is there someone from the family that experiences blindness? None? Okay. Do you wear your sunglasses during exposure to the sun? Sometimes, probably? Okay, sometimes. Do you have any vision loss, or have you experienced any vision loss, or has this affected your daily life? No vision loss, right? Okay. Now, how about your typical diet? Can you describe your diet? What food do you usually eat?
Typical Filipino food like rice and vegetables.
What kind of vegetables do you usually consume?
Carrots, pumpkin,
Mhm.
and green vegetables.
Green vegetables. Okay. How many times a week do you eat meat? Like for a week? Is it 2, 3, 4, or is it week every day? What? Do you eat meat like every day, 2 times a week, 3 times a week? 2 times a week. Okay, 2 times a week. How about fish? Probably 3 to 4. Is it every day? You don't know. You're not sure. It's okay. How about do you smoke or consume tobacco? No. Okay. All right. Thank you. All right. We're done with your history interview. Let me just put that down. Now we'll be going ahead and proceed to the proper procedure. By the way, let me just go ahead and grab my equipments quickly. It's just right here. So for our physical examination, we will be using a handheld Slannon chart as well as a wall-mounted Slannon chart. I will be using an applicator, disposable literal gloves, opaque cards, ophthalmoscope, and pen light. Where is my... Now that we're done with the interview, we're now going to proceed to the eye assessment or physical assessment of the eye itself. We will be first starting with testing the client's distant acuity by using a wall-mounted Slannon chart and asking the client to stand 20 feet away from the Slannon chart and read the letters as far as the client can no longer decipher. We will be using an opaque card or an eye ocular for this test. Now, during testing of distant acuity, we have to take note of certain behaviors that could be a sign that the client is having difficulty in reading or viewing the letters. These signs could be head tilting, leaning forward, or like acting like closing the eye to see properly or see better for the Slannon chart. See the Slannon chart better. Now, we will be proceeding to testing distant acuity, or we will be testing the client's distant acuity. Ma'am, I need you to stand away from the Slannon chart. Okay. Now, I will be needing you to read these following letters that I'm going to point, okay? First, we will be doing this without the ocular or the opaque card. Then we will be doing the cover the eye, okay? Alright. Okay, can you read this?
E, P, E, E, C, D, E, E, E,
Okay. Now we will be covering one eye using the eye ocular. Can you hold this, please? Can you still see this? Okay. Right, can you read this?
E, F, E, F, C, Z, O, C, L,
Okay, the other side.
E, O, E, C, O, E,
Okay. Now my client was able to read the letters clearly. Her vision acuity or visual acuity is, or distant visual acuity is 20/20 for the record. she was able to read all of the letters up to the tiniest letter on this Lennon chart. Now next, we will be testing the near visual acuity of the client by using a handheld Lennon chart, having the client to read the letters from 14 inches near her eye. So ma'am, I need you to read these letters from the biggest to the smallest. I will be placing it approximately 14 inches away from you. And then I need you to cover, you will be reading this first without the ocular or the opaque card. Then we will be doing the cover one eye test, okay? Alright, let's begin. Can you read this?
E,
Next line.
L,
Next line.
F, O, V, E, C, L.
Okay. Now next we will be covering one eye. Okay, read it.
E,
Next.
L,
Next.
F,
The other side. Wait. This one.
H, F, D, Z, J.
Okay, the other side, please. Okay, can you read this?
E, B, L, D, E, H.
Okay. Alright. Now, upon testing the client's near visual acuity, which is usually, this test is being done for those middle-aged client or those clients who's having difficulty with near vision. Now, my client's near visual acuity resulted to 14/14. She was able to read all of the letters in 14 inches in distance. Now, after testing the near visual acuity of the client, we will now come to the testing the peripheral field or the visual field of the client's eye. Now, we will be testing for the peripheral field or the gross peripheral vision of the client. We will be doing this by standing 2 feet away from the client and covering up the left eye of the client, as I will be covering my own right eye. And I will be moving my fingers towards different directions, like from the inferior to the midline, from the superior to the midline, and then from the lateral sides or the temporal to nasal directions. Now we're gonna go ahead and do that by asking the client to stand. Ma'am, can you please stand? Thank you. Now I'll be standing 2 feet away from you. Can you cover your left eye, please? And I'll be covering my right. I need you to focus your eye on my eyes. We will be looking at each other directly. And I'll be moving my fingers from different directions. I need you to say now if you can already see my fingers. Okay? Okay? Alright, can you look at me directly now? Look at my eyes. And I'll be moving my finger now, okay?
No,
Mm-hmm. Look at me directly.
no,
Okay.
no,
Okay.
no,
Alright. The other side, please. Look at me directly.
no, no,
Mm-hmm.
no,
Alright. Look at me directly.
no.
Alright, thank you so much. Now, upon testing the client's peripheral field or vision, she was able to see my fingers at the same time that I can see it. So that means that the client's peripheral field or the peripheral vision is still at normal. Now we'll proceed to testing the corneal light reflex. We will be doing this, this procedure is to test the parallel alignment of the eye or the cornea of the client. We'll be doing this by shining a light towards the bridge of the client's nose and then asking the client to look straight ahead. See if the light reflection is directly at the same spot on both of the eyes. Now, ma'am, I need you to look straight. Can you just focus straight, please? Now I'll be shining light towards you, and I just need you to look straight. Don't look at the light. Don't look at anything else. Look straight ahead, okay? I'm going to be shining now. Okay, thank you. Now, upon testing the corneal light reflex, the light reflection of the pen light reflected on the same spot on both of her eyes, both left and her left and right corneas. As I moved the light from left to right, the light reflection is still at the same spot on both of the eyes. So now we will be doing the cover test. This is for us to be able to determine whether if there are any unnecessary movement once we cover the client's eye or uncover the client's eye during focus. So now we will be doing this by asking the client to focus on a distant object while we cover one of our eyes, and we will be observing any movements on the uncovered eye as we cover the other eye. And then we will be uncovering her eyes again and see if there are any other movements that happened as we uncover her other eye. I will be doing this. Now, ma'am, I need you to focus on something from afar. Let's say, for example, that letter E over there. Now, I'll be covering your one eye or your right eye, or sorry, your left eye. Then you just need to focus on the object, okay? Just focus on the object. Alright? Ready? Okay. I'll be covering one eye now. Okay. Now, after doing the cover test and assessing whether if there are any unnecessary movement as we cover her eyes and uncover her eyes, I have not noted any movement during the cover test, but her eyes are still fixed to the object as I uncover and cover each of her eyes. So that means that there are no noted esotropia, exotropia, tropia, or phaeoria during this procedure. So now we will be performing the cardinal field of gaze test by asking the client to focus on this object or the object that I'm holding as I move it to the different directions. And we will be observing the movement of the eyes. Now, ma'am, I need you to focus on this object as I move it from different directions. And I'll just be checking the eye movement, okay? Alright, can you look at it? Okay, now. Okay, now upon the test for the cardinal fields of gaze test, the client's eye moves smoothly and symmetrically at the same direction, and this movement, her eyes follows the object on all 6 different directions that I've done. So next we will be inspecting the eyelids and the eyelashes. We will be doing this by taking note of the width and the position of the palpebral fissures, assessing the ability of the eyelids to close, and then we have to also take note of the position of the eyelids and the eyeballs, its color, turnings, and take note of if there are any swelling, lesions, or any discharge that shouldn't be there. So, I will be assessing the client's eye. Ma'am, can you please kindly close your eyes? Close your eyes, please. Alright, thank you. Okay. Alright, can you open your eyes and look up? Okay, so upon inspecting the eyelids and the eyelashes of the client, the upper lid margin is between the upper margin of the iris and the eye, the pupil. The lower lid's margin is resting on the lower border of the iris, and then there are no white sclera seen above or below the iris. Also, the palpebral fissures are horizontal. Now, upon assessing the ability of the eyelids to close, the the upper and the lower lids close smoothly and easily, and it meets completely when closed. The upper and the lower lid meets completely when closed. Now the lower eyelid of the client is upright, and there is no inward or outward turning. The eyelashes of the client are evenly distributed and curved outward along the lid margin. And as upon assessing the client's eyelids and lashes, there are no swelling or any discharge seen upon inspection, or any visible lesions. Now we will be assessing or inspecting the eyeballs. So ma'am, I need you to look directly at me, please. Can you look up and down, left and right? Okay. Now upon assessing or inspecting or observing the eyeballs of the client are symmetrical, and it is aligned with the sockets. There are no protruding or sinking. Now we will be inspecting the bulbar conjunctiva of the client and the sclera. We will be doing this by asking the client to look side to side, then up towards the ceiling, and then observe the clarity and color as well as the texture. So ma'am, I need you to look up. Look to the side. And to the right, please. And to the ceiling. At the top, please. Okay. Alright. Now we will be, now upon observation, the bulbar conjunctiva or conjunctiva is clear, moist, and smooth. And underlying structures are clearly visible. The sclera is white, and a brown colored mole is noted on her sclera. Just a small mole on the sclera. Now we will be assessing the upper eyelids of the client. We will be asking the client to just sit appropriately. Kindly look down. And I will be grasping the upper eyelid of the client and putting the cotton applicator to hold that in place without letting go of the lashes. The other side, please. Now can you blink, please? Alright. Okay, now upon inspection of the upper eyelid of the client, there are no signs of foreign object on the upper lids of the client. Also, it is free of swelling or lesions, and it returns back to the original shape or the normal shape after blinking. Now next, we will be inspecting the lacrimal apparatus of the client's eyes. We will be doing this by inspecting or observing first the area over the lacrimal gland and the puncta. So ma'am, I need you to look straight at me, please. Okay. Alright. Now upon observation of the client's lacrimal area, there are no swelling or redness, or as well as the lacrimal area, the puncta is visible and without swelling as well. And it is slightly turned towards the eye. Now next, we will be palpating the lacrimal apparatus by using one finger to palpate just inside the lower orbital rim. Now we will be inspecting or palpating this to see if there will be any drainage. Now ma'am, I will be needing to palpate this. Kindly look up. Open your eyes, please. Okay, the other side. Okay. Now, upon palpation of the lacrimal apparatus and area of the client, there are no drainage noted, and it is smooth in texture and soft. So now we will be inspecting the bulbar conjunctiva. So the bulbar conjunctiva and the sclera, these two are very important to assess because these are the areas where we can be where we can see early signs of jaundice or icterus. So in order for us to do that, we will be asking the client to look from the side to the side and then upward towards the ceiling. And then we will be observing clarity, color, and the texture of the sclera. So, ma'am, I need you to look on your left, please, and on your right, and your up to the ceiling, please. Okay, let me just see that. Okay. Right. Can you look up, please? Alright. Now, upon inspection of the bulbar conjunctiva, the bulbar conjunctivae of the client is clear and moist as well as smooth, and the underlying structures are easily or clearly visible. Now, the sclera of the client is white and has a brown tiny mole noted on the sclera of the client. Now, next we will be inspecting the palpebral conjunctiva or conjunctivae. Usually, this is just done if the client complains of pain or says that she can feel that there's something in her eyes. We have to secure our gloves or put on our gloves to inspect the palpebral conjunctivae of the lower eyelid. We will be doing this by placing our thumb on our fingers on the bony orbit, and then we will be just gently pulling down, avoid pressuring the client. So ma'am, I will be needing to touch you here. Is it okay with you? Okay, now we will gently pull down the lower lid of the client to view the bulbar conjunctivae, or sorry, the palpebral conjunctivae. Ma'am, can you look up, please? Okay, alright. Now, upon inspection of the palpebral conjunctivae, there are no presence of any object or foreign object on the palpebral conjunctivae of the client. Also, the conjunctivae is clear and free of any swelling or lesion. Now, next we will be inspecting, or we will be everting the upper eyelid of the client using a cotton applicator, which I have right here. Let's just gently open this. Now, we will be everting the upper eyelid by grasping the lid and then placing the cotton applicator to hold it, and then without letting go of the upper eyelid. So, ma'am, I will need to grasp your upper eyelid. Is that okay with you? Okay. Just pinch your eyelids here. Close your eyes a little. Alright, now upon inspection of or averting the eyelid or the upper eyelid of the client, the upper eyelid is free of swelling or any foreign bodies or any signs of trauma. Next, we will be inspecting the cornea and the lens. We will be doing this by shining a light from the side of the eye towards for an oblique view of the parts, or look through the pupils and inspect the lens. So I have my pen light right here. Let me just shine it again. One more moment. Okay. Now I will be using my pupil gauge to measure the size of the client's pupil. So may I need you to look up, please? Look at me directly. My other pupil gauge, because I cannot quite see her pupil. So ma'am, look at me directly, please. Okay. Alright. Now, upon measuring the left eye of the client, or the left pupil, her pupil gauge is 4 millimeter. Now, we will be looking on the other side. So, ma'am, look directly at me, please. Look directly at me, please. Look directly at me, please. So, as well as the left eye, it is in 4 millimeter gauge. Now, once that is done, we can now go ahead and assess the iris, or inspect the iris. So, ma'am, I need to look up to me, please. Okay. Look, open your eyes, please. Okay. Now, upon inspection of the iris and the pupil, the iris is typically round, flat, and it is evenly in color. Now, the pupil of the client is round and with a regular border. Also, it is centered in the iris of the client. The pupil is equal in size, which is 4 millimeter, both on left and the right, so there is no anisocoria noted. Now, next, we will test the pupil's reaction to light. We will be doing this by testing the client directly, direct response. We will be darkening the room, removing the light. Okay, just one moment. Okay, now that the room is already darkened, we will now check the client's or the pupil's response or reaction to the light by shining the light on a obliquely into the pupil. So, ma'am, I need you to look at me, please. Look at me directly. Directly at me, please. Alright, so upon shining the light towards the client's pupil, the pupil constricted. Now we will be seeing what size it constricted to. So, ma'am, I need you to open your eyes and look at me directly, please. Side. Okay. Now, upon measuring the size of the pupil as we shine the light towards it, the size of both her pupils constricted to 3 millimeters. So, we will be documenting it as similar form as a fraction. So, for documentation, we will be using, for the left eye, it is 4 over 3, and then for the right eye, it is 4 over 3 as well. So, as we have tried to assess what is the size of the client's pupil after we shine the light through or obliquely through her pupils, it is on gauge 3. So, same as when we measured the consensual reaction of the client's pupil, it also constricted to 3 millimeters. Now we will be testing the ability of her eyes or her pupil for accommodation. We will be needing an object. We will be placing it at least 12 to 15 inches away from the client's face. And then ask the client to focus on this object. Follow it wherever it will go. Okay? Alright. Now remain focused on it. And as I move it closer towards your eyes. Alright? Alright, so let's go ahead and do that. So this is 12 to 15 inches away from the client's eye. Follow this. One more. Okay. Now the reaction of her eyes is constricted. The pupil is constricted and there is convergence of the eye when focusing on a near object for accommodation and of course convergence. So her eyes, technically, when I draw the pen light nearer, her eyes, her eyes dilated, but it goes the opposite when I draw the pen light away. It constricted. Now we will be going into inspecting the internal eye or the internal eye structure. We will be using an ophthalmoscope to view each of the structure of the eyes. Now, using an ophthalmoscope, inspect the inner eye to observe red reflex or the red reflex. Set the diopter at a 0 and stand at 10 to 15 inches away from the client's right eye or right side at a 15-degree angle. So, I will be staying in here. Then we will be placing our free hand on the client's or between the client's head, which helps limit the head movement, and then shine the light beam towards the client's pupil. Now, ma'am, I need you to look straight, please, to an object. Alright? Ma'am, can you open your eyes, please? Okay. Now, upon assessing the client for the red reflex, the red reflex is easily visible through ophthalmoscope, and it is the area is round with regular borders. Now, we will be inspecting the optic disc of the client. We will be keeping the beam of light focused on the pupil and move closer to the client from 15 degrees angle. Now, ma'am, I need you to open your eyes, please. Okay. Now, upon assessing the optic disc is round and probably oval. Actually, it's probably oval with sharp, well-defined borders, and the disc appears creamy yellow and orange to pink color, and approximately 1.5 millimeters wide. So next, we will be checking the borders of the optic disc, wherein upon inspection earlier, the border of the optic disc is surrounded by crescent objects or crescent-shaped objects. Now, we will be inspecting the retinal vessel. We will be staying at the same position, viewing the client's retina. Ma'am, can you please open your eyes again, widely? Alright, now upon inspection of the retinal vessel, there are 4 sets of arterioles and venules that passes through the optic disc. The arterioles are bright red in color, and it narrows as they move away from the optic disc. And then there are venules that are darker red in color and are larger than the arterioles. Both of which narrows as they move away from the optic disc. Now we will be looking at the arterial venule crossing or AV crossing. Now, ma'am, I need you to open your eyes, please, and then focus on something straight ahead. Open your eyes widely. Look straight ahead, please. Okay. Now, upon inspection or looking at the AV crossing, her vein passing the underneath arterioles is seen right up to the column of blood on either side of the arterioles. Now, we will be inspecting the retinal background. We'll be searching the retinal background from the optic disc to the macula, and we will be taking note of the color and the presence of any lesions. So, ma'am, I need you to open your eyes, and I will be just focusing this on your pupil. Open your eyes and look straight, please. Okay. Now, upon inspecting the retinal background, it appears consistent in texture, and there is a red-orange color of the background, and it is lighter than the optic disc. So next, we will be inspecting the fovea and the macula. Ma'am? Hello? Are you okay? So we'll be inspecting the fovea and the macula. We will be shining the light towards the side of the eye, and then we will be asking the client to look directly into the light. Now, ma'am, I will be needing you to look directly into this. Look directly into the light. Now, after inspection of the fovea and the macula is darker in color than the fovea, and which is close in diameter or in size, and it is located in the temporal side of the optic disc. Within this area is the star-like structure or star-like light reflex, which is called the fovea. So next, we will be inspecting the anterior chamber of the eye by remaining in the same position and rotating our lens wheels slowly to +10 or +12. And this is for us to be able to easily view the background or the anterior chamber. The higher we zoom in, the easier it is for us to inspect the anterior chamber of the eye. Now, ma'am, I needed to look directly on the light, please. Directly on the light. Thank you. Okay. Now, upon inspection of the anterior chamber, the chamber is transparent in color and there is no opacity or any foreign object obstructing the view of the anterior chamber. Now, next we will be assessing the eye for any signs of eye trauma. But just in case in the event of eye trauma in which the client is experiencing eye pain or itching or discomfort, or it feels like there is something inside her eyes, we will be needing to observe for foreign body or substance inside the eye. Also assess if there are any perforated globe as well as blood in the eye. So we will be inspecting the eye again. In case of blunt eye or eye trauma, we have to observe for any lids that are swollen, blood in the anterior chamber, as well as the white hazy cornea. And if there is irregularly shaped or fixed, dilated or constricted pupil. So if the pupil is not dilating, it's just constricted all throughout the assessment, so there is a possible eye trauma. If the pupil keeps getting or is only dilated without constriction, that means that it is a possible sign of eye trauma. Now we will be inspecting the eye for any of that. Ma'am, I will need to pull this down. Is that okay with you? Okay. And this one. One more here. Okay. Nothing hurts? Okay. Alright. So upon inspection, there are no signs of eye trauma on the client. There are no signs of blood in her eyes. There are no foreign object. There are no visible swelling or lesion on the eye of the client. And there is no, what do you call this? The anterior chamber of the client comes clear and her pupils was able to constrict and dilate throughout the assessment. So that means that the client's eye is typically in normal condition.